Hi everyone, it's Michelle Grosvenor from Associated Psychology Practice here. How are you going today? So I know a lot of people are feeling pretty stressed out with the whole coronavirus situation, and at times like these it's really important to look after our emotional and psychological well-being. And so I just wanted to talk to you about what options there might be to continue therapy or to start therapy during this time where a lot of people are trying to minimize face-to-face contact with others. And one great option which we have at the practice is to speak to your therapist via Zoom. Now, Zoom is a secure online video platform where you can basically be chatting with your therapist, seeing them and you can watch their facial expressions, hear them, and likewise they can watch your facial expressions, hear you, listen, and provide you with support. Now, I know it's not the same as face to face. It's different, but in saying that, it does have some advantages. For example, if you're having a Zoom session, you can be sitting at home on your comfy lounge with, say, for your cat in the background, like I've got today, drinking a warm cup of tea or coffee and wearing your comfy home clothes, which means that you can be really relaxed. You can also avoid having to travel via public transport or driving and finding parking to attend appointments. So there are some advantages to telehealth, and it's an option that I think more and more people will be exploring in the future, even after the coronavirus has finished, because it does allow a lot of flexibility, especially for people who might struggle to attend appointments during their work hours. So, for example, telehealth could be an option for people who want to have a session during their work lunch break so that they can see their therapist during business hours. So if you're interested in telehealth sessions, there are some key things to note. And one is that you don't actually have to install any fancy software on your phone or your tablet or your device. We as a practice would just send you a SMS with a link, and at the time of your appointment you press on that link and it takes you directly to Zoom. And as long as you've got a smartphone or tablet or PC that is internet connected and preferably with headphones and a quiet space, you can talk to your therapist. Now, the other thing to know is that unfortunately Medicare doesn't provide rebates for telehealth sessions at the moment, unless it's through a box billing service, which we don't provide. And also at the moment, the limitations even around that are really strict and confusing. So what we're doing as a practice is that during this time, with the coronavirus, is that for those who do wish to have a session via Zoom, who've got a mental health care plan, because you wouldn't be eligible for a Medicare rebate, we are going to reduce the cost of the session fee by $50. So that's to kind of share as a practice in some of the, some of, I guess, the challenges that are faced with for our patients in not being able to get the rebate, that we've made that adjustment. So if you're interested in seeking therapy via telehealth, or if you're an existing patient at the practice who wants to explore that option, please give us a call or email us during business hours, and we'll get back to you as soon as we can to outline the options. So our number at the practice is 47223137, and we also have on our APP website some more information about our practice policy at the moment in terms of the coronavirus. So hoping that you're traveling okay, and if you're not, that you get some support. And just to reassure you that should something like a lockdown occur, as a practice we're committed to trying to provide you with as much support as possible, and that would include me doing some regular live streams just to help people with kind of reducing the isolation, but also managing any stress associated with the current situation. So in the meantime, take care, wash your hands regularly, and look in on one another. Thanks for listening in today, and please sorry, lost it there. Please feel free to like, share, or comment this video if you found it helpful. So hope the rest of your day goes well, and talk to you again soon.